Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Now celebrating 17 years of broadcasting success, here's your host, Cyrus Webb.
And welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again, both for our radio audience here in Mississippi at WYAD 94.1 FM and WYADonline.com. We're glad you all could be with us. Also, just tuning in to our friends through iHeartRadio as well as Amazon Music Podcast. Glad you all could be with us as well. Well, among other things, June is recognized as Men's Health Month. And one of the things we want to talk about today in our For Your Health segment is about a condition that does affect many men, and that is when it comes to issues with prostate health. Are you or someone that you love having extreme bathroom planning? If you are a man of a certain age, especially 45 or older, you may be experiencing urgent or even frequent urinary symptoms. And if you find yourself spending more time having to plan trips to the restroom, this might be something you need to take a look at, especially when it comes to a health condition called BPH. Here to talk to us more about that, we're excited to welcome Dr. Gregg Eure to our program. He's going to talk with you guys not only about what BPH is, but also maybe some information you might need to discuss with your doctor as well. Dr. Eure, thank you so much for the time. Really appreciate it.
Well, Cyrus, thank you very much for having me and appreciate the opportunity.
Well, this is an important topic. I think, this is a conversation I know that my father's had to have with his doctor. So, first of all, let's talk about BPH. What exactly is it, and what are some of the symptoms?
Sure. You touched on some as you opened there. The BPH is a very common condition, and it stands for benign prostate hyperplasia. Somewhat medical sounding and confusing. Really, a better way to think of it is enlarged prostate. And all of us men have a prostate, and half of us, it enlarges as we age, and more than half of those men get symptoms. And that's what leads to the frequent urination, the urgency, got to go, got to hurry up and get there, the getting up at night, the stop-start, all those things that impact quality of life, but can also progress over time and impact the bladder and overall health.
Well, I know that Teleflex Incorporated recently sponsored a survey of about 1,000 men ages 45 and up. Dr. Eure, what do the study findings reveal about the effects on the quality of life?
Sure. Well, it was interesting, and it shed light on the common condition of this. It showed that these men 45 and older who had at least one symptom, at least half, or nearly half of them avoided activities because of their urinary symptoms. 2/3 would limit how much they drink during the day or especially in the evening. And again, that's not a good thing with summer upon us now.
Right.
20% would seek out and stay close to a bathroom. They would plan their events, or as we start getting out and traveling again, bathroom mapping, knowing where the bathrooms are, or even avoiding places because of not a bathroom. Impact on sleep is huge. 70% said it impacted their sleep, and that's obviously going to impact your overall health. More and more studies are showing the importance of sleep. Plus, it is very likely impact your partner's sleep as well. The other thing that study showed too, Cyrus, was that many men feel medication is not enough, and we're learning too sometimes you've got to continue these medicines to get the benefit, and they can sure have side effects.
Well, I think that's a great segue then to one of the things that I know you want to talk to our audience about, Dr. Eure, and that is about the UroLift system procedure. How is that different from other treatments, like you just mentioned, medication or even surgery?
Right. So the medications have been around for a long time, but again, like we said, you need to continue taking them to get the benefit. And often that prostate continues to enlarge over time. So the medication, although may be effective initially, may not over time. Plus, again, we're learning more about side effects. Some of the most common medications, a recent, very well-done study showed that men who take these over the long term have an increased risk of heart failure. So again, we're learning more about this as well. On the other end of the extreme are more invasive procedures, men referred to as a roto-rooter, but procedures where you remove prostate tissue, a little more to recover from, a little more exposure to side effects. And so there's just been a need for something minimally invasive to address the enlarged prostate, to address the symptoms with avoiding the side effects of medication and more invasive surgeries. And that's where the UroLift system is really growing in popularity and usage across the country and actually around the world. It's a minimally invasive procedure. It's done either in the urologist's office or surgery center. It's a relatively rapid recovery, and what it does basically is open up the prostate, remove that blockage, and get men off medications, yet improve symptoms more so than what they were experiencing on the medication. And one of the most popular things that it can help with is it helps preserve sexual function, which is important to many men.
Right, exactly. Well, great information as we're looking at our For Your Health segment during June, which is recognized as Men's Health Month. Again, everyone, Dr. Gregg Eure has been our guest. Dr. Eure, really appreciate the time today. Can you tell us where our audience can go for more information?
Sure. I would direct them to the website urolift.com, and that's UROLIFT, urolift.com. And that can start them on the journey to seek more information and talk to their doctor about this more in detail.
All right, and the conversation with the doctor is so important. Dr. Eure, really appreciate this information. Urolift.com is that website. We'll make sure that we link it up for our online audience. And Dr. Eure, looking forward to having you back on the program again.
I appreciate it, Cyrus. Thank you very much.
Hey, thank you. And we thank your audience for tuning in to another great segment of Conversations Live. Until next time, I'm your host, Cyrus Webb, saying as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live. Now let's go make today amazing. Take care.